coming from a position of strength and unprecedented growth, Rizal Med continues to respond to the needs of its constituents. By virtue of our location near C5, we get a lot of trauma cases and neurological cases, both surgical and non-surgical. Hence, we have chosen to focus our efforts on surgery and neuroscience. The lack of a center, whether government or private, catering to psoriasis patients, plus the resurgence of leprosy, has also prompted us to serve the gaping need of patients suffering from these disfiguring diseases. To address the need for centers catering to patients with cancer, and in anticipation of the National Cancer Control Act, Rizal Med commits itself to providing comprehensive and referral holistic care for these patients with catastrophic cases. All these efforts will entail a change from our basic service capabilities into becoming the preferred Department of Health multi-specialty and referral center in ophthalmology, surgery, dermatology, neuroscience, and oncology with a 500-bed capacity in 2022. This is in line with our vision, mission, and core values, and also in line with the Department of Health's Formula 1 Plus, with the strategic goals of better health outcomes, a more responsive health system, and financial risk protections for our patients in our hospital. We take these high-impact goals to heart and have incorporated them in our strategy map. The details of each area is found on your handouts, starting page 8, but allow me to expound on 3. This is the strategic objective and deliverables for patient care, which can be found on page 12 of your handout. Dermatology committed to produce clinical pathways for atopy, psoriasis, and leprosy. The department commits to produce evidence-based pathways and adhere to them. With adherence to these pathways, variation in patient care will be lessened, resulting in excellent quality care, leading to a decrease in the average length of stay, a decrease in case-specific mortality rates, and an increased census for the service. This is the strategic objective and deliverables for linkages, which can be found on page 16 of your handout. For capacity building, family medicine committed to enroll at least 2 health officers from Pasig and Rizal Province in the practice-based family medicine residency program. We already have an existing memorandum of agreement with Pasig City, and we will also spearhead enhancing the service delivery network with Taguig, Pateros, and Mandaluyong. The capacity building will hopefully result in a certified family medicine specialist who will serve in their area, and the active SDN will both lead to a decrease in primary and secondary cases referred from partner LGUs, because they have already their own specialists to treat their constituents. This will allow Rizal Med to really focus on those patients with complex cases needing tertiary level care. This is the strategic objective and deliverables for research, which can be found on page 16 of your handout. Research is usually done by doctors and nurses. We are going beyond the usual by joining non-medical and non-paramedical staff to do operations research. With the whole organization doing research, we will be adding to clinical human knowledge, and we can institute quality improvements from the results of operational research. Our PGS journey started just last April 2018 when we were invited to the Philippine Heart Center to learn about their best practices. Our TW coachers also participated in the PGS Basic Bootcamp last August, and the other activities followed with a cascading workshop just concluded 2 weeks ago. Even though we just started recently, we have gotten the commitment of our department heads, and for redundancy and sustainability, they're second in command. 24 units in the medical division, 21 units in the nursing division, 5 units in the admin division, and 4 units in the finance division. We have all covered 54 units in Rizal Meds for 100% coverage. We are also filling up our slots for medical officers and medical specialists to further improve our training program. Even though the dermatology department only started last 2017, we're now getting a lot of patients with